All right, welcome back. This is WASH video number 3. It's the last in our WASH video series. And this, as we talked about before, we have 2 WASH programs. One is school-based and one is community-based. And they are linked, as we've already talked about. So let's first talk about the link. Well, it doesn't take a genius to understand that if our goal is to reduce intestinal infections and diarrheal diseases in children and in mothers, if we only give a child clean water, soap with hand washing while he's in school, and then send him home to a home that has human waste contaminated water and no soap to wash his hands, or have his mother wash his hands after the use of the toilet, then we are not going to be effective in reaching our goal. Now, most programs, unlike Hope Corps, would have stopped at a strong school-based program, which we have. But unfortunately, that doesn't get the job done. And so it's extremely important then to get WASH into the student's family. And going back to what we talked about in WASH video number 2, that's why one of the main reasons we do the School Health Club School to Community program, not only to help teach the children more about WASH, but to give them the chance to bring WASH into their own home and soap into their own home. So when they leave school, they continue to have clean, treated drinking water, and also the ability to wash their hands with soap. So that's pretty obvious then as to why we need the community program to supplement and complement what we're doing in the schools. But the other very important thing is when you look at what is the most vulnerable population for diarrheal diseases, and that is the younger children, the preschool children. These are the infants, the toddlers, and the preschool child from age 1 day to age 5 years before they enter our school system. So if we only focus then on mothers that have children in school and the children in school, we are missing the most vulnerable part of the population for WASH. Now, luckily for us, we have 200 community health volunteers which are going to undergo a level 1 certification program in January. And probably none of you have heard much about this, but in January we have funding, and with the help of the MedTrek nurses and with the videos that Achessa and Garrett are putting together, we are going to do a 5-day training for all our 200 community health volunteers. And WASH is going to be extremely important part of that 5-day training. We'll also train them on vision testing in the preschool children. We will also obviously go over family planning. We will have them educated on the use of our free health hotline, the availability of our office clinic, and we will have them trained to bring into the family, like the health club students, we will bring in and leave behind a bottle of WaterGuard for every family, soap, if we can, depending on cost, and oral rehydration packets. We will teach them the danger signs for diarrheal diseases in small children, and also the danger signs for pneumonia and breathing issues in small children. We will focus on the importance of breastfeeding as an ancillary component to our WASH program, and with that as a method for child spacing, which will lead us then to family planning, and of course bed nets for malaria defense. So basically, in that 5-day program, this will be a level 1 certification. We will then bring them back in 6 to 12 months and do a level 2 and finally a level 3 certification. It will be required of all our 200 community health volunteers. They will not be able to receive their stipend unless they've shown that they have successfully completed this certification course, and then it will be offered to the Minister of Health of whether he would like to partner with us for the other 800 community health volunteers in Tharaka and Nethi County. But definitely we're going to do our 200. Now, each of our community health volunteers, as I understand it, has 50 families of which they make a circuit of. And so if you have them bringing in wash products like WaterGuard and soap and oral rehydration therapy, which I'll talk about in detail in another video on why it's critical treatment for diarrheal disease, then that creates a great impact. And we will also have this may already occur, that each volunteer will not only have 50 families then to monitor, but also certain schools within our area. And this can help us as far as monitoring whether there is soap with the hand washing tanks, whether the latrines are properly kept, whether there is any kind of menstrual hygiene training facility. So they can be a great use to our WASH team. But the thing that I'd like to stress in this video is that we're not going to roll out the community health volunteers as part of the WASH program until after they're trained, which probably means the end of January 2020. So at the beginning, we want to focus on what I've talked about in WASH 1 and WASH 2 for the months of October, November, December. And as we then get that set up correctly, then at the end of January, we're going to be entering the 200 community health volunteers after they've been trained in WASH, and the WASH team will be part of that 5-day training in January. So let's take a step back and look at the potential and impact of Hope Corps' WASH program when you throw everybody in. And as medical director, this is extremely important for me, because what I'm going to talk about in a second is that of all the people that are potentially going to work with us in the community and in the schools for WASH, I only have to pay 200 of those people. So let's look at that. So if we look at our 200 community health volunteers, and each of them then is going to service 50 families, 200 volunteers serving 50 families each, times 5 persons per household, you find out that's 50,000 people then that can be reached by 200 community health volunteers, which I do have to pay. If we then switch to the health clubs, we find we have 150 health clubs with an average of 25 students each, which means that we have 3,750 junior, if you wish, student community health volunteers. And if they go into the community in our school to community program and each just reach 2 families, that means that we're basically going to have another 7,500 then families reached. And if you add that times 5, you see what that comes out. And then if you look at our 400 teacher health champions, who I don't have to pay, then you have 200 of those. You have 400 teacher health champions. They are responsible for 200 schools. Each of those schools has 250 students, which 200 times 250 is 50,000. So we end up with easily over 100,000 people in the community that we can impact with our WASH program. And yet I'm only responsible for paying the salary every 2 weeks of 200. So that is an incredible reach of Hope Corps' WASH program, and we have to maximize it. This is how we leverage our effect in the community. And I've said to you before, this is absolutely critical for Kenya moving forward. Kenya is looking, remember, at when I first came to Kenya in 1987, 18 million people. When I was back in Kenya last month, 46 million people. By 2050, 30 years down the line, we will have 85 to 90 million people in Kenya. There are 12 million students in the Kenyan Ministry of Ministry of Education right now, and that will grow in 2050 to 24 million students. So you see the importance of leveraging our ability. And this is what makes Hope Corps so unique, because not only do we look at the individual child, the individual mother and child, the individual school, and what we can do for them, but we look at the big picture of what we can do for Kenya and how we can create medically effective, cost-effective, and scalable systems that can be brought up into millions of children. So leveraging that becomes one of the key important factors of what Hope Corps brings to the table. And that's why one of the main reasons that we won that international grant award for $100,000 over 430 other applicants. That was not coincidence. It is because we have pioneered unique and scalable solutions to key problems, and WASH is one of those. So what you can be proud of what you're doing. You can be proud of what you're taking on. I am pushing you probably in a direction that maybe you weren't expecting to go, that you were expecting mostly to focus on just the 200 schools and leave it with that. That's not enough. We do not want to do that at Hope Corps. We want to use school to community with our health clubs. We want to use the 200 community health volunteers that we're going to teach, as well as the 400 teacher health champions. And eventually, we are going to bring WASH and WASH education and make it an integral part of the core school curriculum. So this is the end of our 3 WASH videos. This is an extremely important program for health and for Hope Corps. And as I hope you've learned in the last 3 videos, is that WASH is inextricably linked to the other health modalities that we're going to bring into the community. And as I started with video number 1, for WASH video number 1, WASH is the foundation of all health for a young child then. And we need to get this WASH technologies, the clean water, the WaterGuard treatment, the soap, the good latrines, and proper human waste disposal to every mother, particularly who has any young children in the community. So I am looking forward to having you join me on this, creating a very unique, a very effective program that, as far as I know, no other group in Kenya or of East Africa has been doing this. I've made multiple trips to Tanzania, to Uganda, and Rwanda, and I can tell you that nobody has a program quite like ours. So it's something that you can be proud of, and I look forward to working on this with you, and this will be the last video on our WASH, at least as of this time. Thank you.